Good evening, everyone. Welcome to today's class. Let me just give some few minutes to those who are joining so that they can join and participate in what we are doing. Okay. Um, I think we are ready to start. So today we are looking at introduction to retinal pathologies in optical coherence tomography. Okay. Okay, good evening once again. Thank you for joining us. This is Dr. Wisdom. I'm in Lagos, Nigeria, and today we want to look at introduction to to the retinal pathologies in optical coherence tomography. So a quick introduction: the retina is a thin, light-sensitive layer of the tissue that lines the back of the eye. The optical coherence tomography is one of the tests or a major test we use to determine how the retina looks like. Are we together? So the optical coherence tomography is a non-invasive technique for cross-sectional tissue imaging. Any practitioner who wants to fully understand retinal pathologies and wants to be good in what he's doing, to be able to identify pathologies in the retina and to be able to make a good diagnosis will be or must be able to understand must be able to fully understand the structured layers of the retina. That is when the retina is without abnormalities. So because for you to know the unknown, you have to know the known first. So having a good knowledge of what a normal retina looks like, it gives you a good edge when you are looking at an abnormal retina. So quickly, let's look at what we have for the day. Now, the normal retina, the OCT, uses reflected and scattered light in the chorioretinal tissue to separate the layers into three basic layers. We have the cellular layer, we have the fibrous layer, and then we have the boundaries. So when light is shine, when the OCT probe light brings light to your retina, the way the light bounces back, it helps us to understand if we are looking at the cellular layer, the fibrous layer, or the boundaries. So this separation is done based on intensity. So the intensity of light tells us if we are looking at the cellular layer, if we are looking at the fibrous layer, or if we are looking at a boundary. Are we together? So the cellular layers are weakly reflective because they reflect light weakly, and we call this a hyporeflectivity. So any layer that doesn't reflect light so much, we call it a hyporeflective layer. While the fiber layers and the layer boundaries, they reflect light so strongly, hence we call them a highly reflective layer. So please never forget this part. Now, the nuclear layers are hyporeflective, and I will say why this is so in a short time. The cellular layers comprises of the ganglion cell layer, the inner nuclear layer, and the outer nuclear layer. So whenever you are looking at your OCT results, you will find out that these layers, which are the ganglion cell, the inner nuclear layer, the outer nuclear layer, they will all appear as hyporeflective. They will not be as bright as other layers. And again, the cellular layers are weakly reflective because they are made up of neuronal cell bodies. So any structure in the retina that is made up of neurons will not appear brightly in the OCT, while the fiber layers and the inner plexum layers are highly reflective. Again, the Henle fiber layer, which is the histological fiber layer of the outer plexum layer, is not included in the hyperreflective layers, and there's a reason for this. The hyporeflectivity. So when we say hyporeflectivity, we mean this low reflectivity we see in the Henle fiber layer is due to a forward tilting of this layer towards the macula. So when the beam of light enters the retina, it doesn't hit it perpendicularly. So it causes, because of the light not hitting it perpendicularly, it causes a hyporeflectivity that should have been hyperreflective. And we call this phenomenon the Henle fiber layer hyporeflectivity due to fiber orientation. And we must be careful not to mistake this as an atrophy. We must be careful not to mistake this as a cyst or a schisis. But then when the probe of the OCT machine, when it enters in an eccentric position, we notice that a hyper reflectivity is seen. So the Henle fiber layer becomes hyperreflective only when the OCT measurement beam enters the pupil from an eccentric position, thereby causing the retina to perpendicular to the Henle fiber layer. So in this case, when the probe enters in an eccentric position, we will notice that the Henle fiber layer will become hyperreflective, which used to be hyporeflective. So this is a normal cross-sectional image of the retina layers. So in this image, you will be able to appreciate all the layers of the retina. So let's quickly look at this. You see the fovea. The fovea will have a depression here. You can see this depression here. This is where the fovea is. Then this black parts here, these are the vitreous, and then this is the temporal nerve fiber, and this is the nasal nerve fiber. So we can also note the nerve fiber layers, the ganglion cell, the inner plexiform layer, the inner nuclear layer, the outer plexiform layer, the outer nuclear layer, the external limiting membrane, the inner photoreceptors, the inner and outer photoreceptors, the outer photoreceptors, the RPE, and the RPE/Bruch's membrane. So if you look at this image, you'll find out that some layers appear bright, some layers appear dark. So this is because of what I have just explained earlier, that the cellular layers are hyporeflective, while the fiber layers are hyperreflective, and also the boundaries are also hyperreflective. And again, let's keep that for now and then look at some anything else. So, but then, did you notice that the nerve fiber layer here is thicker here than in this place? There's a reason for that. So the nerve fiber here is thicker than this. So I want you to tell me the reason as a DM, or whether you send me a message on WhatsApp, or post it here on the comment section so that others too can learn. So just in case you are joining, please, I plead that you subscribe to this YouTube channel, you like, comment, and share, and please or drop a comment. So let's look at the retinal cell types. There are three cell types. We have the photoreceptors, we have the interneurons, which we also call the processing cells, and then we have the output, and then the output and support cells. So let's look at the photoreceptors. The photoreceptors is made up of the rods and cones. The rods are specialized sensitive cells for low light, black and white, and peripheral vision. So when we are looking at an object straight ahead, what we use to view peripheral things are the rods, and they are larger in number and more sensitive than the cones. While the cone cells are active in the daytime, the rods are active at night, and unlike the rods, the cones are more concentrated in the periphery. The rods are more concentrated in the periphery, while the cones are densely packed in the fovea centralis. So in the peripheral area of the retina, we find out that we have more of rods there, while when we go close to the macula, especially in the fovea centralis, we find out that the cones are more densely packed. The photoreceptors are absent in optic nerve, which contributes to the blind spots. So when we look at the optic nerve, it is void of the photoreceptors. Now let's look at the interneurons. The interneurons it is made up of the bipolar cells, horizontal cells, and all other cells. So the bipolar cells receive signals from the photoreceptors. So their duty is to receive signals and then send it to the ganglion cells, while the horizontal cells are responsible for increasing contrast and also adapting to bright and dim illumination, while the amacrine cells helps to process motion and fine-tune signals. So all these cells, they play important roles in vision. Now when we look at the output cells, we are looking at the ganglion cells, the molar cells, and the retinal pigment epithelium. The ganglion cells are located at the ganglion cell layer, and they receive visual impulses from the photoreceptors through the bipolar and amacrine cells. So the bipolar and amacrine cells are like link between the ganglion cells and the photoreceptors. One thing that is so important about the ganglion cells is that their axons extend into the brain and also forms the optic nerve, chiasm, and tract. Remember we said earlier that the photoreceptors are not part of the optic nerve or the optic nerve head, but here we see that the ganglion cells, they extend into the brain and they also form the optic nerve, chiasm, and tract. So a small percentage of these ganglion cells are not responsible for vision, but they play important key roles in circadian reading and pupillary light reflex. And also the W, X, and Y ganglion cells, which are types of ganglion cells, they form the three major types of the ganglion cells. And then we also have 5 classes of ganglion cells, which include the midget cells, the parasite cells, the bistratified cells, the photosensitive ganglion cells, and other ganglion cells. And these other ganglion cells are responsible for saccade eye movement. Let's look at the molar cells. The molar cells provide architectural and metabolic support for the retinal cells. Now, a serious research has gone on, and we find out that a dysfunction in this molar cell results to diseases such as diabetic retinopathy, macular edema, retinal vein occlusion, age-related macular degeneration. This is because the molar cells have neuroprotective properties. Now, I'm trying to think a lot, and I'm thinking, if the molar cells have neuroprotective properties, are they vital in providing the cure for glaucoma? This is me now thinking aloud. So we are hopeful that research will keep going on, and that we can see that if we can extract the neuroprotective properties of the molar cells, or see how they can be extended to provide neuroprotection for glaucoma. This is just me thinking aloud. So the output cells, let's look at the retinal pigment epithelium. So the function of the retinal pigment epithelium is to provide nourishment for the retinal cells. It also absorbs scattered light, also provides immune privilege for the eyes, and secrete factors. And one of the important factors it secretes is vascular endothelial growth factor. So we see vascular endothelial growth factor come into play when there is shortage of oxygen to the eyes, and then you see these vascular endothelial factors will cause new blood vessels to grow, and these new blood vessels, they are not strong, they are fragile, and then they proliferate. So this is the retinal pigment epithelium is responsible for this growth factor called vascular endothelial growth factor. Now, the normal retinal cell layers, the most hyper-reflective, which appears brightest white, is a band. It has more than 3 lines together. Now, this retinal pigment epithelium, it is the most hyper-reflective when we are looking at an OCT result, and it appears as a band with more than 3 lines. But then above these 3 lines, there is a layer called the external limiting membrane, which is not as bright as the lower 3. So it is a common misconception that the retinal pigment epithelium is the only layer there. But when we zoom this layer under the spectralis system, it shows that the RPE layer has 2 distinct layers called the photoreceptor inner and outer segment junction, and then the RPE itself. So the first line we see, which I will show you the image soon, is the outer membrane of the retinal pigment epithelial cells called RPA and Brooks membrane complex. Now, the second hyperreflective line is the inner membrane zone of the retinal pigment cells, now referred to as the interdigitation zone. Formerly, it was called the cone and rod outer segment tips, which is cusp and rust, but now the new name is interdigitation zone. The third hyperreflective line is the junction between the inner and outer segments of the photoreceptors, previously known as the inner segment to outer segment junction, but now known as the ellipsoid zone. So this is an image of what I'm trying to explain all this while. So in this place, here you can see that this retina, the OCT image of this retina, you can see that this place here, this band here, has three lines. When it is zoomed, it has three lines. Now these 3 lines are very, very hyper reflective, and we want to understand what they are. Now, the outer retinal layer, you can see this is an enlarged image of those 3 lines I'm telling you about. You can see the part highlighted in green is the outer membrane of the retinal pigment epithelial cells, while the part highlighted in purple is the inner membrane of the retinal pigment epithelial cells, also now known as the interdigitation zone. And again, the last part, which is the orange part, is the junction between the inner and outer segments of the photoreceptors, which we know as the ellipsoid zone. So this is just a quick summary or a brief introduction on the retina. So remember, we want to look at retinal pathologies, but before we can delve into the vast world of retinal pathologies, it is important that we understand this little basic landmarks of interpreting the OCT results while looking at the retina. So in our next class, which is next week, we will delve further to try to understand more about the retinal layers. And when we are done with that, we will now begin to look at pathologies proper. So thank you for tuning in today. Remember, this is Dr. Wisdom. I would love to get your comments. I will